Hi, I'm Dr. Lamarche, a nephrologist. Welcome to this video series on advanced chronic kidney disease. This is the second of 6 videos. We recommend you watch all 6 videos in order. This video will talk about treatment options for kidney failure and more specifically about peritoneal dialysis. Subtitles are available if you need them. Just click on the symbol at the bottom of the video. This video is also available in French. Here are the different treatment options for kidney failure: peritoneal dialysis, in-center hemodialysis, home hemodialysis, kidney transplant, and conservative kidney management. First, we will talk about peritoneal dialysis. Peritoneal dialysis is a type of dialysis that uses the peritoneal membrane. The peritoneal membrane is a thin layer of tissue that covers your intestines and the inside of the abdomen. This membrane has special properties. It contains a lot of blood vessels, and so it is able to filter the blood when we do peritoneal dialysis. Peritoneal dialysis uses dialysis fluid. A dialysis fluid is a liquid that contains water, sugar, and minerals. In peritoneal dialysis, the dialysis fluid comes in transparent bags. When the peritoneal membrane is in contact with the dialysis fluid, it filters out waste products and extra fluid from the body into the dialysis fluid. In order to do peritoneal dialysis, you need to have a peritoneal dialysis catheter. This catheter is a small tube about the size of a drinking straw, which connects the inside and the outside of your abdomen. Let's go over the steps when doing peritoneal dialysis. First, the bag of dialysis fluid is connected to your abdomen through tubing and a catheter. The abdomen is filled with the dialysis fluid. The peritoneal membrane allows the waste products and extra fluid to move from your blood to this fluid. The dialysis fluid stays in your abdomen for a few hours. The dialysis fluid now contains the waste products and the excess liquid, a bit like urine. After a few hours, you connect your catheter to an empty bag. The dialysis fluid is then removed from your belly through the catheter and into an empty bag. This process is called an exchange. It needs to be repeated in order to clean your blood properly. Here are a few key points about peritoneal dialysis. It is usually done every day. It is done at home. You or your care partner do the treatments. You can call your healthcare team for support if needed. Now let's talk about the peritoneal dialysis catheter, which connects the inside and the outside of your abdomen. About 15 to 20 centimeters of the catheter is visible outside your abdomen. When wearing regular clothes over the catheter, it is usually not noticeable. Your catheter can stay in your abdomen as long as you need it. It is very important you keep this catheter clean to prevent an infection. Your healthcare team will teach you how to use this catheter and keep it clean. You can shower and swim in salt water like the ocean, but you cannot take a bath or go in a pool with this catheter unless it is a private chlorinated pool. Here's a picture of the catheter. Now, how is the catheter put in? Catheters are placed either by a surgeon, a radiologist, or sometimes a nephrologist. You may need to be put to sleep for the procedure, meaning being under general anesthesia. Your catheter should be inserted a few weeks before you start dialysis, so the skin and tissue around the catheter can heal before it is used. Your healthcare team will discuss with you the best time to have your catheter inserted. With peritoneal dialysis, the schedule is very flexible. It is important to keep in mind that the dialysis can be adapted to your needs. The material required to do the dialysis is delivered to your home on a regular basis, usually monthly. This type of dialysis requires training. An experienced nurse will teach you how to do dialysis. This teaching takes place in a clinic and usually takes about 1 to 2 weeks. There are 2 ways of doing peritoneal dialysis. You can do the exchanges manually or with a cycler, which is a small machine. Let's talk about the first technique, the manual technique. You connect the bag of dialysis fluid to the catheter and the abdomen is filled with dialysis fluid. Once the abdomen is filled, you can disconnect the bag from the catheter. You can do your usual activities for about 4 to 6 hours. After 4 to 6 hours, you connect your catheter to an empty bag and empty the old dialysis fluid into that bag. With the new bag of dialysis fluid, you fill your abdomen again. Again, once your abdomen is filled, you can disconnect the catheter from the bag. You again do your usual activities for about 4 to 6 hours. This is repeated usually 4 to 5 times during the day. The other way to do peritoneal dialysis is with a cycler. A cycler is a small machine. It is usually kept at your bedside. Connected to this cycler, there are bags with new dialysis fluid and empty bags. You connect the catheter to the cycler at night when going to bed. During the night, the cycler fills and empties your abdomen every few hours while you sleep. In the morning, you disconnect the catheter from the cycler and can do your usual activities. This is repeated the following night. The cycler is about 40 centimeters wide by 40 centimeters deep and 20 centimeters high. It is provided to you at no cost. Here are the advantages of peritoneal dialysis. Compared with in-center hemodialysis, peritoneal dialysis is done from home, does not require any travel time to the dialysis center, has a flexible schedule, offers more independence, allows for a more stable blood pressure during treatment, is easier for the heart if you have heart problems, and allows easier travel on vacation. Here are possible disadvantages with peritoneal dialysis. You need storage space at home. Usually you need about 2 meters by 2 meters space for storage of the dialysis fluid bags. You need to keep your catheter clean. There is a risk of infection with peritoneal dialysis. Some people experience discomfort when filling and emptying the abdomen with the dialysis fluid. If you are experiencing discomfort, this is something you should discuss with your healthcare team. You generally have to do dialysis every day. Now, when is peritoneal dialysis not an option? Some people who have had major surgery on their abdomen or who have really bad intestinal problems cannot do peritoneal dialysis. Some hernias will need to be repaired before doing peritoneal dialysis. Now, take some time to think if peritoneal dialysis would be a good choice for you. Write down any questions you have for your healthcare team. Having chronic kidney disease and having to make a decision about your future treatment is not easy. There are support groups in the community that can help you. They're often run by kidney disease patients or their caregivers. Support groups offer information, support, and links to resources that might be helpful to you and your family. You can also visit the Kidney Foundation of Canada's website to connect with their support group. Click on the link in the description of this video at the bottom of the screen for more information. You can also pause this video and copy the link which is shown on the screen. You can also ask your healthcare team about support groups in your community. This is the end of the video on peritoneal dialysis. In the next video, we will talk about another type of dialysis called hemodialysis. When you feel ready, click on the link below to start the next video.